We are glad to have had this digitalization of healthcare from the smart PCN, which the government is about to launch. We have been installed with the digitalization, that is smart PCN, which is TIBU system. So initially I've been using these registers in front of me here, and it has been bulk because you have to write about 3 books at the same time. So with the digitalization, it's become easy. You can access the information of a patient easily.
Kurenon Fancy Tonu en meng'indetab Sosit West. So kimwoe kongoi en biikab community promoters kikotoretech. Kikotoretech amun kikenyoru services en haraka. Aya, in terms of ng'alekab cheu netishek, lagok ngosich tabu nebo tung'oek kenyoru ngap itu en haraka, imuche ibirchi simoit ak koit. Ko kiketoretok.
When a patient is being referred from the community by the CHP, that is the community health promoter, you are able to see the information of the patient in the system. You can be able to see the history of the patient. If the patient has been seen in another facility, you can easily see the information of that patient. Initially, you couldn't see that. What you could have seen is only the paperwork, and sometimes you find the results have been tampered with, so it's not accurate. It is easy to generate monthly reports, which was very tiresome. With a click of a button, you can get every information you want from that patient. Also, queuing of the patients, it only takes less than 10 minutes. You are done with the patient, and the patient doesn't move with a lot of papers. Even our table is now clean. We have only a computer and equipment for testing and screening the patient. I think the digitalization is a key thing we can embrace in our facilities and in our communities.
With the new system, the HMIs, currently we've been able to curb the dangers that have been the gap in the previous system. The health community promoter has been able to capture the conditions or the diseases that are in the community, and they can be managed at the community. With the new system, we've been able to avoid duplications in that the community health promoter, once they've been registered at the community, once they are referred to the health center or dispensary, they maintain the same number with the history that has been documented to the community health promoter. And once they reach, in case they are not being managed at the health center and the dispensary, once they reach the level for the Kapkatet Hospital, the history that was in the previous registration will be received, and further managements can be done, and that has enabled the patients to get enough services, not as before. Once the outpatient number has been generated at the community level, with the community health promoter, they'll just come and update and do the necessary lab tests and any other investigations, and then that will help at a health center or a further level 4 facility, that's Kapkatet, not to repeat the tests that were done. And that will help in management of the logistics, the lab reagents and the x-rays that will be done only. Once every day, the new system, the HMIs, every day you'll be able to know the daily workload basing on the residence, the age, you can be able to get the report easily. And at the end month, you can do the reports, mention the top 10 conditions, and that will help. So it is so easy. It's a nice system.
We have a digitized system all the way from the community to the health facility. So at the community level, the community health promoters are using a system called ICHIS. Once the patient is registered, if a person is sick, then they are referred to the facility using the ICHIS, and this shared record is viewed at the facility. But they also have the benefit of having a system, and they're also digitized. They use tablets and laptops, whereby they can be able to view the referral from the community. Once they view the referral, they treat the patient at their level, depending on the nature of disease. If the disease is exceeds their capacity, the level 2 or level 3 dispensary or health center facility can refer that patient to level 2 facility. It is seamless. From the community to the health facility, there is no use of papers. And then the shared record can be accessed by the dispensary, the health center, but also by the sub-county. In case the patient deteriorates along the way, they can just come to the main facility and they'll still be able to be treated.
This is a mandate from which we started the work a few years ago of developing the Kenya Health Enterprise Architecture that designs how all the systems that are currently running in the country can operate as one, to allow for data to move and to allow for us to convert it into impact, access, and all the rest.
Be able to generate reports also automatically, thereby reducing the paperwork and also enhancing the workflow of the health records information officers. There's no duplication of work. For example, before the system, usually what used to happen is that at the health center level, the dispensary level, they write the name of the book and the age and the details of where the patient comes from. But now, since the patient has already been registered, then you don't need to write those details again. And also at the facility, those details are pre-populated.
We already trained the community health promoters and equip them with end user devices in the form of mobile devices, which are loaded with the e-community health information system. This allows us to register the patients at home. As soon as this information is gathered, this information moves and is held within the shared health record, which is among 8 registries run by the Ministry of Health as shared services for use by all. It is through this that we've also come to implement a health management information system, which is end-to-end. By end-to-end, I mean it's able to work on all the clinical modules and take the patient through a workflow, while also helping the administration to run the other side for human resource management, commodity ordering and management, and all these other tasks, all in one MOH-backed system.
We have a system which runs in the community units used by the community health promoters. Again, we have a system, a point of care system, Tibabu, which is used in the facilities. And this is an ERP system, enterprise resource planning, which is very huge. And this is a system which is being rolled to be used at the spoke and the hub levels.